Good morning, class. Today I wanted to respond or address some news by Eli Lilly, a major player in Big Pharma, one of the really big dogs, has decided to close down their neuroscience research institute. And this is actually just a continuing domino of a long-running trend. And I just wanted to address it to my neuroscience and drugs, brain, and behavior classes because it's very relevant for both. And just to be aware of what's going on the the R&D sector on Big Pharma side. So it's very easy and common and it's almost fun to demonize Big Pharma. Today I'm not exactly their biggest fan, seeing how they just laid off or shut down their neuroscience division. But that is not just Eli Lilly. Pretty much all of the big players in Big Pharma have shut down their neuroscience research units. So the main catalyst of this was the failure of an Alzheimer's drug. So basically, people have worked for decades trying to figure out the role that plaques and tangles play in Alzheimer's disease. And then we found drugs that target the plaques and tangles. And we were able to reduce these in rats. And then they moved this to clinical trials. And basically, it appears maybe you could reduce the plaques and tangles in people, but it didn't really matter. Maybe this is more of an epiphenomenon. I don't know. The etiology of Alzheimer's and how plaques and tangles are involved is probably a little more controversial than it was a few years ago. Not exactly my area of expertise anyway, so I'm just going to leave it at that. But that's not really the point of this. It is what is going on with neuroscience pharmacology research within the private sector. And it is a very dark day, a very, very dark day. It's interesting to me because when I was a graduate student, I actually considered, the private sector, Big Pharma, to be the exit-like strategy, like Plan B. If I don't get my own research lab and become a professor, I'll go work for, Eli Lilly or Pfizer or Merck. All of these are gone. I mean, Pfizer was especially an interesting one because they moved a lot of their labs from Michigan to Massachusetts to the Boston area. And then just a few years after setting up this grand, ginormous lab, to do neuropharmacology research, they closed their doors too. And for the most part, all Big Pharma neuropharmacology research institutes are closed now. So, what's going on? Point one is that, the majority of neuropharmacology drugs that are out there for the most part, already developed before neuroscience research began. I mean, really, they were there and sort of hit the market in the 70s and 80s with psychiatrists just sort of, throwing things at patients and seeing what stuck. Not really thinking about mechanism. And then we got into sort of more mechanistic development. And that has led to a few, drug developments. But the thing is, most of those had already hit the mark through just sort of trial and error before we even got to that point. So we are, not really able to come up with new drugs, and that is, a problem. What's really primarily done now is chemists, through rational drug design, tweak a few molecules to make a slightly different drug that they can patent. When the original patent ran out and, marketed it as a slight improvement. And that's sort of the way that things are going rather than novel neuropharmacologies. And, this also has to do with money, of course. I mean, so not only is Big Pharma not really being effective in producing big money new drugs through basic research, they are, it's cheaper to just let it develop on the academic side and then buy the patent from a university. I mean, so if I developed a new drug, technically the university would own that patent rather than me. And the university would choose whether or not they wanted to sell it to big pharma, which they almost always would because they have the development tools and mechanisms that we don't, and the marketing and all that stuff, of course. But I also want to bring up the issue of the attacks on big pharma. I mean, and how this actually could impact R&D as well. So, I mean, like, to be clear, I do think that, what we just discussed, or I just described, is the primary driving force here. But, it bothers me a little bit that everybody wants to demonize the idea of big pharma making